is on medroxyprogesterone acetate as from my experience as a trans woman. I'm going to be using the information that came with it. Okay, it's Medroxyprogesterone Tablets, and it's pronounced Medroxyprogesterone, and the US brand is Provera. I'm not sure the other brands around the world, but it's Medroxyprogesterone acetate. They're oral tablets, and the maximum is 10 milligrams is what I was taking. It's a round tablet that's white, and it's for hormone replacement therapy, HRT. Do not take this with estrogens to prevent heart disease or dementia. Using estrogens may raise your chances of having a heart attack, a stroke, breast cancer, a blood clot, or dementia. Use estrogens with or without progestins for the shortest time needed at the lowest useful dose. From all my research and everything on progestins, that's more like the synthetic version of, for the most part, synthetic version of progesterone. From all the research I've done. What is this drug used for? It is used to lower the chances of endometrial changes in women after change of life who are getting estrogen therapy. It is used to treat uterine bleeding due to hormonal imbalance. It is used to treat females who do not have a monthly period cycle. That's teens, like women, if you're transgender or cisgender, because it's used also for transgender women. Because if you do research on it, you'll find some information on trans women, like trans females, like teens and adults. This may be given to you for other reasons. Talk with your doctor. What do I need to tell my doctor before I take this drug? For all uses of this drug. If you have any allergy to medroxyprogesterone or any other part of this drug, if you are allergic to any drug like this one, any other drugs, foods, or other substances, tell your doctor about the allergy and what signs you had, like rash, hives, itching, shortness of breath, wheezing, cough, swelling of the face, lips, tongue, or throat, or any other signs. If you have had any of these health problems, bleeding disorder, blood clots, or risk of having a blood clot, breast cancer, other cancer, liver disease, heart attack, stroke, or tumor where estrogen or progesterone make it grow. If you have unexplained vaginal bleeding, if you are breastfeeding or plan to breastfeed, for all reasons other than cancer treatment. If you are pregnant or may be pregnant, do not take this drug if you are pregnant. This is not a list of all drugs or health problems that interact with this drug. Okay. Sorry about the noise in the background, just the kitties playing. Okay, this is not a list of all the drugs or health problems that interact with this drug. Tell your doctor or pharmacist about all of your drugs prescriptions or over-the-counter natural products, vitamins, and health problems. You must check to make sure that it is safe for you to take this drug with all of your drugs and health problems. Do not start, stop, or change the dose of any drug without checking with your doctor. What are some things you need to know or do while taking this drug? For all uses of this drug, tell all of your healthcare providers that you are taking this drug. This includes doctors, nurses, pharmacists, and dentists. Because like even dentists, you can actually change how it affects your teeth, like your gums and stuff like that. Like pain or bleeding and stuff. It can, especially in flossing and things like that, from my experience. Blood clots have happened with this drug. These clots have included heart attack, stroke, and clots in the leg, lung, or eye. Sometimes blood clots can be deadly. Tell your doctor if you have ever had a blood clot. Talk with your doctor. Talk with your doctor if you need to be still for long periods of time, like long trips, bed rest after surgery, or illness. Not moving or long periods may rise your chances of blood clots. Call your doctor right away if you have signs of blood clot like chest pain or pressure, coughing up blood, shortness of breath, swelling, warmth, numbness, changes of color, or pain in the leg or arm, or trouble speaking or swallowing. Liver problems have happened. Call your doctor right away if you get signs of liver problems like dark urine, feeling tired, not hungry, upset stomach or stomach pain, light-colored stools, throwing up, or yellow skin or eyes. If you have high blood sugar, diabetes, you will need to switch your blood sugar, watch your blood sugar closely. High triglycerides levels have happened with this drug. Tell your doctor if you have ever had high triglyceride levels. Have a bone density test as you have been told by your doctor. Talk with your doctor. Take calcium and vitamin D as you were told by your doctor. Because what my doctors were saying, and from my experience, while taking hormone replacement therapy, you will be low in vitamin D. It doesn't matter if you're male or female, whatever version you're taking, you will be low in vitamin D, especially during the colder winter months, because the positioning of the sun, you'd be even lower. And it's good to take calcium because it helps with the bones and everything. Have blood work checked as you have been told by your doctor. Talk with your doctor. There may be a high chance of breast cancer. Be sure to have regular breast exams and gynecological checkups. Your doctor will tell you how often to have these. You will also need to do breast self-exams as your doctor has told you. Talk with your doctor. Usually it's once a month when you do that, once every month. But for those who are going through like puberty type changes, if you're transgender or a teen, trans teen, cisgender teen, I suggest know your cycle. So before you take the progesterone for those days, do an exam then. When you're taking the progesterone, do an exam then. Then after, when everything goes back to normal, do an exam then. That way you know the difference between each parts of the hormones as it changes with the changes in your breasts. So you know the difference. So you know what's normal and what's not normal. So if you do have something there, like a blood clot, you can talk to your doctor and get it resolved as quickly as possible. This drug may affect certain lab tests. Tell all of your healthcare providers and lab workers that you take this drug. This drug may cause dark patches of skin on your face. Avoid sun lamps, and tanning beds. Use sunscreen and wear clothing and eyewear that protects you from the sun. My experience with the sun, when I was taking this, certain parts of my body end up getting burned a little bit more, especially if I hasn't been in the sun for a long time, like my legs and my shoulders, like through back all through here, my shoulders up this area usually gets the worst, and my inner thighs, my outer thighs around those areas. If you are 65 or older, use this drug with care. You could have more side effects. Hormone replacement therapy, HRT. High blood pressure has happened with drugs like this one. Have your blood pressure checked as you have been told by your doctor. With my experience, I've had normal blood pressure and sometimes high when it's checked at times, so just be cautious about that. Yeah. There may be a higher chance of endometrial cancer. What are some side effects that I need to call my doctor about right away? Warning, caution, even though it may be rare, some people may have very bad and sometimes deadly side effects when taking a drug. Tell your doctor or get medical help right away if you have any of the following signs or symptoms that may be related to a very bad side effect. Signs of an allergic reaction like rash, hives, itching, red, swollen, blistered or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing, or talking, unusual hoarseness or swelling of the face, of the mouth, face, lips, tongue, or throat. Weakness on one side of the body, trouble speaking or thinking, change in balance, drooping on one side of the face or blurred eyesight, very bad headache, very bad belly pain, bulging eyes, sudden change in or loss of eyesight, change in eyesight, change in how contact lenses feel in the eyes, a lump in the breast soreness, or nipple discharge, breast pain, which breast pain is during the fluctuation of your hormones. Normally you will have breast pain when that change happens and your breasts swell up during that time of the month before they go back down to their normal size, and when everything just drops down back to their normal size and all that when doing that change. Vaginal itching or discharge, vaginal bleeding that is not normal, low mood, depression, swelling, seizures, signs of high blood pressure like very bad headache or dizziness, passing out or change in eyesight, signs of gallbladder problems like pain in the upper right belly area, right shoulder area or between the shoulder blades, yellow skin or eyes, fever with chills, bloating or very upset stomach or throwing up. Well, I'll talk about bloating after this part. Signs of a pancreas problem, pancreatitis, like very bad stomach pain, very bad back pain, or very bad upset stomach or throwing up. Signs of low calcium levels like muscle cramps or spasms, numbness, and tingling or seizures. Mood changes, which that could be a part of your normal hormone cycle. So be aware of that, because that does happen. Memory problems or loss, feeling confused. And with the mood changes, it can happen up to 2 weeks before it's hormonally your time of the month. So be sure around stuff like that. Okay, what are some other side effects of this drug? All drugs may cause side effects. However, many people have no side effects or only have minor side effects. Call your doctor, get medical help if any of these side effects or any other side effects bother you or don't go away for all use of this drug. Weight gain or weight loss, which that can happen during that time of the month. My experience with medroxyprogesterone is my weight usually stayed normal, and being on hormone replacement therapy over time, I did gain weight to a certain point. But what I'm taking now, usually I lose a few pounds and it goes back up to normal. So that might happen with this one. Headache, dizziness, feeling sleepy, feeling nervous and excitable, upset stomach or throwing up, bloating. Okay, that could be part of your hormone cycle. Even in trans women, it happens. If you're cisgendered or transgender teen or an adult, it can happen. And it happened with me. Bloating. That's usually because instead of having a uterus, it's more towards like intestinal and all that. It's where it usually happens in trans women. Changes in sex interest, which that's never really happened to me. Pimples, acne. Well, it can actually, during that time of the month, hormone changes can happen. Hair loss, hair growth, which I noticed hormone replacement therapy through here, the hairline, I did gain hair. And most other parts of my body had lost hair, like towards the bikini line, lost hair, like the stomach right under the belly button, that area. Sorry for the noises, the cat's playing. Lost hair there and decreased hair in my underarms, which I've had laser on that too. So what's left, it takes about a month for that hair to grow back. And leg hair, I have had decreased there. Okay, feeling tired or weak, enlarged breasts, tender breasts, that can happen during your hormone cycle during that time of the month. Vaginal bleeding or spotting, belly pain, not able to sleep, no period or other period menstrual changes, hormone replacement therapy, HRT, stomach cramps, joint pain, leg cramps. Okay. These are not all of the side effects that may occur. If you have questions about side effects, call your doctor. Call your doctor or medical advice. Call your doctor for medical advice about side effects. You may report side effects to, if you can see that, it would be this one right here where my finger is. It would be that one. Okay, I'm going to stop here because my SD card's about to be full. So I'm going to stop here, come back, and finish up. One thing I want to mention about the breast pain and tenderness. If you're a teen, if you're a trans teen or trans adult going through the puberty stages of hormone replacement therapy, part of the progesterone's job is with, because the breast pain and tenderness, a lot of times when your breasts are growing, it's because the ducts within your breasts, the mammary glands, are developing. So that's where a lot of the breast pain and tenderness is coming from. And when those are fully developed, then your breast ends up, they're bigger in size than those who never have had progesterone in their system. So I suggest take progesterone. If you know how the hormone cycle works, it's usually a year after puberty starts, progesterone starts to do its thing regularly. So a year after you start hormone replacement therapy, I suggest add progesterone to it to help create that normal hormone cycle, like the female hormone cycle. And when those mammary glands are developed, those are the ducts and the glands and that tissue in there. That's what helps to make the milk when you're pregnant. So also when you're on progesterone, from what I know, it's at least 3 months straight in a row, every single day for 3 months. If you're like a trans woman, teen, adult, or cisgendered woman, it will cause you to produce milk because it helps to raise the lactose, that prolactin, and it'll help produce the milk. So you'd be able to breastfeed that way. So that's where a lot of the breast pain and tenderness can come from. It's the progesterone growing those ducts. If you're going through the puberty stages, the mammary glands. So that's one thing I wanted to add. And that's with my experience has happened. And if you do not go on progesterone, your breasts will be underdeveloped because like these, mine, for such a long time were underdeveloped because my dosage of things weren't where they're at now, which I'm still going through changes, so be aware of that. Is one thing that can happen and will happen. Okay, what is this drug? How is this drug best taken? Use this drug as ordered by your doctor. Read all information given to you. Follow all instructions closely. To gain the most benefit, do not miss a dose. The way I took it sublingually, that's under the tongue. Because when you take it sublingually, what happens is it absorbs into the bloodstream much quicker and gets directly into the bloodstream, and bypasses the kidneys and liver. So you don't have issues there. And some of it may or may not fully absorb. Or if it goes mucousy, I suggest just swallow it, what's left, so you get all that dosage. And one thing I've noticed during the hormone cycle for me as a trans woman, because it was the highest amount I was able to take is 10 milligrams of medroxyprogesterone. And I noticed when I take it and it's normal in the system, it's at least 5 days and everything becomes normal in the system of any prescription. I noticed it goes up. Then I noticed that weird fluctuation where I have peaks and drops because how low the progesterone is in the system with medroxyprogesterone. I noticed I had peaks and drops a lot, so be aware of that. So if you can, I suggest take micronized progesterone, which I'll be doing a video on that soon. So keep that in mind when you're going through your hormone cycle, because you can have those peaks and drops and you can tell the difference and feel it, especially towards the end of the day at night if you take it in the morning. So just be aware of that. What do I do if I miss a dose? Take a missed dose as soon as you think about it. If it is close to the time of your next dose, skip the missed dose and go back to normal time. Do not take 2 doses at the same time or extra doses. How do I store and throw away this drug? Store at room temperature. Store in a dry place. Do not store in a bathroom. The reason why you don't want to store in a bathroom, because that moisture that happens, like especially if there's a shower in the bathroom, because that moisture can actually damage the prescription by, when it gets into it, actually softens it and makes it gooey and mushy. And it just is not good for your prescription. So never ever store in a bathroom ever. My suggestion is, if you have like a dresser or a closet or just someplace like that where you can put it so it's stored in a continuous temperature that's at the right temperature. So that's what I usually do, in a closet or a dresser, and that way the temperature doesn't sit there and get too hot or too cold for it to be stored. So that's part of my suggestion right there. Keep all drugs in a safe place. Keep all drugs out of reach of children and pets. And I've had an issue when I put my prescription down, and it was one of the cats tried getting it, so be careful with pets and children because they can be really harmful to them. Throw away unused or expired drugs. Do not flush down the toilet or pour down the drain unless you are told to do so. Check with your pharmacist if you have questions about the best way to throw out drugs. They may be drug take-back programs in your area. From all my research about drugs, if it's an actual pill version, like there's liquid versions, like gel capsule versions, or versions where it just has oil in it as a binder, or just the hard pill version. Okay, the hard pill versions of prescriptions, from what I learned, they actually never expire. They don't. Even though there's a date on it, they actually don't expire, especially like over-the-counter stuff. They just put a date on it so you can get it used up by then and buy more. It doesn't really expire as long as it doesn't get damaged by moisture and other means. So do a little bit of research on that is one of my suggestions. General drug facts. If your symptoms or health problems do not get better, or if they become worse, call your doctor. Do not share your drugs with others. Do not take anyone else's drugs. Keep a list of all of your drugs, prescriptions, natural products, vitamins, over-the-counter with you. Give this list to your doctor. Talk with your doctor before starting any new drug, including prescription or over-the-counter natural products or vitamins. Which I have done that, and multivitamins are usually recommended when you're on hormone replacement therapy, just so you're not low in anything. So I know it's okay to take them with hormone replacement therapy, but still talk to your doctor. Some drugs may have another patient information leaflet. Check with your pharmacist if you have any questions about this drug. Please talk with your doctor, nurse, pharmacist, or other healthcare provider. If you think there has been an overdose, call your poison control center or get medical care right away. Be ready to tell or show what was taken, how much, and when it happened. Consumer information, use and disclaimer. Okay. This information should not be used to decide whether or not to take this medicine or any other medicine, Only the healthcare provider has the knowledge and training to decide which medicines are right for a specific patient. This information does not endorse any medicine as safe, effective, or approved for treating any patient or health conditions. This is only a brief summary of general information about this medicine. It does not include all information about the possible uses, directions, warnings, precautions, interactions, adverse effects, or risks that may apply to this medicine. This information is not specific medical advice and does not replace information you receive from the healthcare provider. You must talk with the healthcare provider or for complete information about the risks and benefits of using this medicine. Okay, I know that was a lot to go through and to process if you're deciding to go on hormone replacement therapy. In my experience, it's necessary to go on progesterone. I've read some doctors' opinions where they say if you're a trans woman, don't go on progesterone to get your breasts bigger and just get breast augmentation. But then later on in the article, he contradicted himself and is saying when a trans woman or a woman is on progesterone, because those mammary glands, those ducts in those glands, it helps to develop them, and when they're developed, your breasts are bigger and fuller in size. And from my experience, that is true, 100% true. It's just when you go to take progesterone, I suggest the big thing, try to figure out your hormone cycle, because not everyone reacts to it the same on certain days. So you need to find out, it's like trial and error to find out which days is the right days for you to take the progesterone, and make sure to take it the same day every single month, starting the same day. Like for me, it may not be the same for anyone else out there, but I start on the 6th, then I end on the 15th. And I noticed doing it that way for me, or the days for me, and my cycle isn't all over the place. And that actually does help with all the changes, especially when it's the puberty stage when you're going through all those changes. So I'm just giving all this information to help anyone out there, if you're cisgender, teen or an adult, or a trans teen or an adult, who are thinking of starting their transition and researching and thinking of going on hormone replacement therapy, like male to female hormone replacement therapy, just female hormone replacement therapy. This is just things to go through and think about if you're deciding to, so you're more educated and well informed. And I suggest still talk to your doctor and do lots and lots of research on your own. Because for me, before I even started hormone replacement therapy, I did tons of research before even starting. So I know the benefits, the risks, what can happen and what may not happen, and all the benefits and things that aren't really benefits, and all the things that can and can't happen. So I'm more educated about it, and with this information it can help you be more educated about it. I also suggest to do further research beyond this video, so you're more educated and well informed. So you're just not jumping into something that may not be right for you. And in my experience with the progesterone, combined with the estrogen and testosterone blocker, it's helped with my hormone cycle to be normal, like more normal. This is with the medroxyprogesterone when I was on it. It just kind of felt a little off, like it would go up, then I would have the drops and another peak and the drop every morning for those 10 days. Is how I was feeling, like my hormones were still too low. And this is coming from my experience, and what I'm taking now, I don't feel that. So this is my experience. It just felt like there's peaks and drops, and it does affect your mood. And I think sometimes it can affect how you feel sexually towards people and whatnot, and your attractions and other things. This has come from my experience and how you feel. And that was kind of like all over the place for me until I got onto what I'm taking now. So if you can't take micronized progesterone, this would be a good alternative to that, because if you have like side effects or just things like that, allergic reactions and things to like peanut oil or peanuts, then I would suggest take this, even though it's lower dosage and it isn't as strong or as effective. So this is coming from my experience and from the bottom of my heart. I'm sharing this information to help all of you out there who are cisgendered or are thinking about possibly taking this, if you might need to, especially if you're a trans teen who's starting puberty, or a trans adult who is starting that change in the puberty stage of all this. From the bottom of my heart, I'm sharing this information to help all of you out there. So you have the information out there that I didn't really have when I started. So you're not struggling trying to find all this information and stuff. So, from the bottom of my heart, I wish you happiness and a successful journey, and to use this information to help you along on your journey through this beautiful transition that we go through as trans individuals. So, from the bottom of my heart, from me to you, thank you for watching this video to get the general information that you need. And I just wish you happiness and good luck on your journey.